Hello, I'm Dr. Najawan, an anesthesiologist and medical director of obstetrical anesthesiology at Aurora Sinai Medical Center. What follows is an overview of labor epidural anesthesia for labor pain. If you're still interested in receiving a labor epidural after watching this video, we'll ask you to view a second video that describes risks in greater detail. Let's talk a little bit about how epidurals work. One of our anesthesia providers will place a thin and soft catheter into your lower back using an epidural needle. The needle is then removed and we can provide medication through this epidural catheter whenever we want, including continuously with a pump, just like an IV pump. The epidural catheter is ideally placed while you are sitting, but also can be placed while you lay on your side if necessary. Positioning is very important for success, and the nurse and our anesthesia team will assist you with the best positioning. As far as the pain of the epidural needle, most women report that receiving the epidural is less uncomfortable than receiving an IV. This is for two reasons. First, we numb up your skin with local anesthesia, and secondly, the middle of the back has less nerve fibers than the rest of the body, and you should mostly feel pressure. If you feel discomfort going to the left or to the right while we are placing the epidural, you should let us know, and we'll make an adjustment so that you are only feeling pressure. Again, we'll leave a catheter behind, and this will be taped to your back, which will not be painful. Typically only takes a couple of minutes to place the epidural catheter, and you should start experiencing pain relief within 15 minutes, sometimes sooner. The epidural catheter is left in place until after delivery of the baby. Once the epidural is working, you may feel warmth, tingling, numbness, heaviness, or weakness in your legs. It's important to be realistic about the kind of pain relief you'll receive in epidural anesthetic. Epidural anesthesia is quite effective at significantly reducing labor pain in the stomach and back. As labor progresses, you will notice either vaginal or rectal pressure. This sensation is more difficult to eliminate. In fact, it is important to have some sensation with your contractions so that you can help with pushing when it is time to deliver your baby. If both your legs or feet are warm and tingly, and you do not have significant abdominal or back pain with contractions, your epidural is working well. We do have the option of adding another medication which can provide some assistance with the pressure sensation, but not necessarily eliminate it. Once we have added the second medication, and you do not have stomach or back pain with contractions, this usually represents the maximum relief that we are able to provide. On occasion, because of a very large baby or the manner in which baby is passing through the pelvic canal, there may still be significant pressure or discomfort with contractions. What about after the epidural anesthesia is stopped? It can take as long as 3 to 4 hours for the anesthesia to completely wear off. It's very important that you receive assistance the first time that you walk, because you may be weaker than you realize, and you can risk falling and hurting yourself. Most times, when there is isolated numbness left over in the feet or legs, it is related to difficult labor or difficult delivery, as is the case for back pain. You'll have a slight soreness at the point where the epidural needle was inserted, but this should only last for a couple days and rarely can last beyond that. Usually a heating pad and Tylenol or ibuprofen will treat this discomfort. An epidural catheter is one option for labor pain. Your obstetrical provider can inform you about other pain relief options that are available. Thank you, and best of luck to you and your family.